Hometown Happenings is brought to you by Foothill 7 TV and the Thompson's family of automotive dealerships.
Welcome, ladies and gentlemen. My name is Michael Dennis, and along with me, the lovely Michelle Snyder. And you know what we're going to talk about today, Michelle?
What's that?
We're going to talk about the science of acupuncture. Now, let me tell you how this all came about, okay? I am not into this touchy-feely, my wife is. She puts fumes and stuff around the house, and she schmusses the house. You know what that is? Mm-hmm. She burns this stalk of something, sets off all the smoke alarms, and obviously that gets rid of the bad spirits. But I'm not a touchy-feely kind of guy. Give me a beer and a needle and a pill, and I'm fine. Well, nothing seems to be working for my leg, which has been burning up for a year now. And it's forced me to move away from traditional medicine and look to non-traditional medicine to get some help with the pain. And what I'm finding out is that what we call non-traditional has been around for thousands of years. And I think that by definition, that's traditional. So tell me, first, what made you, Michelle? Michelle runs a clinic called Path to Vitality on Corker Street in Placerville. And she's a great lady, and she's taken the time to come here tonight and talk to us. Actually, it's today, it's not tonight, but we'll be seeing this tonight. And talk to us about how acupuncture works and why do it. So first tell me, Michelle, how did you get into this acupuncture business?
Well, I've always been interested in medicine and very intrigued about how the body works. And I never knew what capacity that I wanted to utilize that knowledge. So I went to school and got my Bachelor's of Science degree. And
what did you major in?
It was in kinesiology. So
really? They have a major in kinesiology?
The study of human body movement.
Okay.
So a lot of anatomy and physiology. And the degree really was preparing me for a career in physical therapy.
Gotcha.
And I did some externships, found out physical therapy was not what I wanted to do. But I graduated with the degree and I went out and worked. I had a series of administrative jobs that I was quite miserable at. So I did that.
We've all
Yes,
been there, yeah.
I know. So about 10 years into sitting behind a computer every day, I said I have to do something different. So I started hearing all these words about acupuncture. I started finding people that were using it for different health conditions, and I'm like, what is this acupuncture? All I know, it has something to do with needles, I think, and that's kind of strange and creepy. So what is all of this? So I started researching on my own and became fascinated about Chinese medicine, of which acupuncture is a branch of that medicine.
And what is it, like 2,000, 3,000 years old?
It's at least 2,500 years old.
Wow.
And long story short, I ended up quitting my job. I packed my car full of all my belongings, and I went to acupuncture school at 39 years old.
There are about 1,000 people out there standing up and applauding you right now for doing what we don't have the guts to do sometimes.
Well, I was lucky.
39, that was just last year.
Yes, it was.
She's lying. I know, isn't it incredible? Looks like she's 23. It's acupuncture. I think it works.
I think so.
So then you just decided you wanted to be an acupuncture. And where do you go to school for something like that?
Well, there's private universities that specifically they're Chinese medicine schools, and they're colleges that teach just Chinese medicine. So they're private institutions. And it's a 4-year degree. It's a Master's of Science degree, and it's soon to be a doctorate level degree. So it's a lot of education.
All those plaques I see on your wall were earned.
Yes, absolutely.
Earned by college student loans, I bet. Huh?
Yes.
But, it's amazing that you gave me some literature to read, and I didn't know this, folks. It's been around for thousands of years. It wasn't until like 1970 that we got hep to what was going on.
Yes. So in 1972, President Nixon took a trip to China, and with him was a man named James Reston. He was a New York Times reporter. And the story goes that James, while he was in China, suffered an appendicitis attack.
Oh,
so
my.
He had an emergency appendectomy in China, and the post-operative treatment was acupuncture for pain management. And James was so impressed about the relief that he received from acupuncture while in the hospital that when he came back to the United States, he wrote about his experience with acupuncture, and that really helped publicize acupuncture in the United States. Like, gave it some
That's
publicity
amazing.
that it needed. So
It's amazing that one individual can bring the seed to flower. And, like Michael J. Fox with Parkinson's disease.
Right.
Nobody knew what Parkinson's was. And until Michael J. Fox, who would think Michael J. Fox would bear answers to millions of people's problems?
Exactly.
So besides the touchy-feely thing, we know needles are involved. We're going to talk about them. But what, essentially, they're meridians in the body. You separate the body into two halves, so to speak, and what is it, 14 places? I don't know. What am I talking about? Help me.
well, our bodies have a very intricate network of what we call channels or meridians, and they're invisible pathways that course throughout the entire body. They penetrate every organ system and every tissue of the body. And along these particular channels are very anatomically specific points, which are acupuncture points. So as an acupuncturist, what we do is we stimulate these points with very fine needles to transfer energy and nutrition to the areas of the body that are compromised. It could be an organ, it can be a particular tissue or a part of the body that's in pain. And through the stimulation, we are directing energy and nutrition to that area to promote balance in that area, which results in healing and improved function.
Okay, so you have these meridians. From what I understand, the Chinese think that the balance is very important. Like, you guys seen the yin and yang sign, yin and yang? All of that stuff has to do with a balance, high and low. They try to get you to a middle point where the body actually heals itself, right? Am I correct?
That's correct.
So that's what you're doing by putting these, and by the way, how many acupuncture points are there in the body?
Well,
Thousands?
Thousands. Traditionally, there's 365 points, which correlated exactly with 365 days of the year. Those are our classical points that most acupuncturists will draw from on a daily basis. But since the ancient times when acupuncture was created, there have been hundreds of points that have been
But not everybody has used them. Chinese did, but we haven't.
No, we do as well.
We do.
We do as well.
Okay, so you stick the needle in one of these points, and then the word qi comes in. Okay, I've done some studying for this because I didn't want to look like a total idiot. What is qi? C-H-I.
Qi, from a Western concept, is energy.
Right.
And
Let me explain. They said in the book that having qi, the opposite of not having qi is death. Qi is a life force.
it is a life.
So you're dead, you don't have qi. You're alive, you have qi. The purpose is to get that qi in balance.
Correct.
So that's a life energy. Okay, now it's hard for a Western culture to understand, but I believe that the body does work within itself. I mean, even traditional medicine gives room for that. So you stick a needle in, and it touches the acupuncture point in the hopes of getting a balance of qi.
That's correct.
How do you know if you did that? By symptoms and.
It's the improvement of symptoms. By the end of the treatment, most people feel something different, usually an improvement. They feel better. They may have less pain. So that's telling me as a practitioner that what I'm doing is working. We've rebalanced that whole mechanism of qi in the body and that it's doing its work.
So like my leg, because of my back injury, the nerve in my leg is on fire. And when I go to you, you put needles in my feet, you put them in my back, you put them above my butt, you stick them in my ear, and all of that is using what you have learned to balance this qi force.
That's correct.
And hopefully to get me, because right now the qi is screaming, I'm in pain, and it's running to my right leg. You're trying to settle me out, and that in essence is going to take away the pain.
That's exactly how it works. Also, there's a whole theory behind dealing with pain. It's kind of a separate specialty within acupuncture.
Oh,
But
really?
also what we're doing with the needles is we're interrupting basically the pain signals that go to the brain. So that's one way that how acupuncture works to lessen or minimize the pain that a patient feels.
Doesn't Norco do that? Norco
it
blocks
does.
it, right?
But this is a natural way of
Right.
pain relief.
Right.
And a way that to try to help the body relieve pain on its own versus going towards a pharmaceutical medication to do that.
Then you're talking about pain. The thing I think that holds most people from considering acupuncture is the word needles. Needles
Needles.
scare people. And there's a big difference between the needles you use and the needles we know of. I mean, I know from and I'm just an idiot, a needle for an injection site, a Western doctor, is a tube. And fluid has to run through it. And therefore, it has width to it. These don't.
Yes, the needles are actually the width of a cat's whisker. So they're very pliable and soft and very thin, just like a cat's whisker. So they don't elicit the type of pain that a hypodermic needle does that we're familiar here in the West, that's used to draw blood out of a vein or to inject medication into a muscle. So we're dealing with very fine, teeny little needles.
Well, just to prove it to them, because you all know I'm a weenie, I'll be screaming and yelling, put some needles in my hand.
I'd be happy to.
I will sacrifice my peace. Now, I was petrified of this when I first walked in. I absolutely have no fear of it now. You clean the area that you're going to put the needles.
area.
It's quite amazing, actually.
And the acupuncture needles are stainless steel,
Right.
surgical grade stainless steel needles.
All
And
sterilized. And
they're all sterilized, individually packaged. And so after the treatment, they actually go into a sharps container, so they're not sterilized and reused again. So there's
gotcha.
very low risk of any type of infection.
go do it. It really doesn't hurt. It's amazing. I haven't been affected by these things at all. I have been to a couple of sessions and, oh! No, I'm kidding. I just did that for her sake. Yeah, I was waiting to see what kind of reaction she has if I passed out on the table.
I know Michael all
Yeah.
too well.
I am actually talking to you while she's sticking these needles in my hand, and truly, it doesn't even feel like a pinprick. It just feels like, I don't know, like she's messing with me, but it doesn't hurt. And when she presses on these points, sometimes I actually feel energy right from the point. I mean, I could feel like something happening, but I don't know what it is, and she does. That doesn't hurt at all. They're really tiny, and sometimes you put electrodes to them to send a current.
Yes, to send a microcurrent through the needle into the tissue, and it's really helpful for pain conditions.
Right, it's like a TENS unit, I guess. So what conditions can you treat with acupuncture? What kind of condition?
It's very broad. In fact, the World Health Organization in 1996, actually, in response to really the worldwide interest in acupuncture, they compiled a list of what acupuncture effectively treats based on controlled clinical trials.
Right.
So they broke it down in a list by body system. So cardiovascular, hypertension, these are things that we can treat.
Anxiety.
Anxiety,
That's a big
emotional
one with women too,
disorders.
isn't it?
Yes, anxiety and stress. Gynecological issues, so a lot of women issues, pediatric diseases as well.
You work on the kids?
Yes.
How do they sit up to this? They must flip out in the beginning.
We don't actually use needles on children until they're older.
So you use pressure points?
We use a combination of Chinese massage techniques and pressure points.
Wow.
So
You have a 4-year-old. Have you used pressure points on your kid?
I give him a massage every day.
You do?
And I
My wife doesn't do that.
massage certain acupuncture points almost daily. I don't always
Just
get a chance
to
to
bless
do
him
that.
with good health.
Yes.
Good mama, good mama. So how do you, we have things from anxiety to foot pain to nerve pain, all these things. What about a disease? Can it literally cure a cancer? Has it?
It is not in the scope of acupuncture to treat cancer. We treat the side effects of cancer treatments.
Nausea.
Nausea and vomiting, some of the muscle pain that can be a result of the
Chemo.
that they take. As far as curing anything, we treat people's bodies to heal themselves. And sometimes that's successful and sometimes it's not.
Right.
But in most cases, there's usually always some type of improvement with a person's condition, utilizing acupuncture as a form of medicine.
I think that's really honest. You know, a lot of people go into the business of acupuncture, and you've spent a fortune going to school, and you've got to pay those bills. And so they go in and they, you know, acupuncture is a cure. Acupuncture, she's saying that acupuncture will alleviate symptoms of body disease, pain, anxiety, stress. They're not going to take my two backbones and make them better. If my vertebrae are pinching a nerve, you're not going to be able to unpinch that nerve. And that's fair. That's what I was looking for. I was looking to get some pain moderation. And this certainly has done it for me. And it's nice that you come forward and tell people directly what you can do and what you can't do. How do you tell what's wrong with me? How do you diagnose an issue? Like, you used a thing called pulse. What is that?
Yeah, so there's numerous ways. We diagnose a patient as soon as we see them, as soon as they walk through the door. So we're evaluating how are they walking, how is their posture like, how is their speech. We're looking at certain colors actually on their face can tell us a lot of different things.
The tongue, you told me.
Yes. And so we take actually a physical history. We go over their entire medical history. We see the pharmaceutical medications they're taking. And then we go into the Chinese form of diagnosis, which we use the tongue and the pulse, which is very accurate.
I just got to tell you, you know, this could get very awkward at times too. When she first said, you know, we use your tongue, and I went, oh my God, I brushed my teeth. I didn't brush my tongue this morning. I need to brush my tongue. I'm dry mouthed because I'm taking all this medication. I'm going to stick my tongue out, and she's going to see little lepers walking on it and think I have the plague. That freaked me. The tongue thing.
Yes.
What could you see on a tongue?
Believe it or not, it's very accurate. We can see the state of health of the organ systems of the body. We also look at, the tongue will tell us temperatures of the body, which we use a lot in diagnosing. Somebody's too hot, somebody's too cold. And we can tell that from the tongue. So It's a very accurate diagnostic tool. We also, and actually most people are very hesitant of sticking out their tongue. When I tell them to stick their tongue out at me, they look at me like,
well, yeah,
what am I supposed to do? And they get very nervous.
Unless you have a wooden stick in your hand, that's what they say.
Yeah, very hesitant about presenting their tongue.
Get out of my mouth. Get out of my mouth.
In their mouth. Yeah. And then we also palpate the pulses on both wrists.
What do you mean palpate? Show me on, how do you take a pulse?
Okay.
Go to a close-up of this, Skylar. Go ahead.
So I use 3 fingers, starting at the wrist, on each side. And I have 3 levels of positioning that I use on the wrist. So I'm starting very superficial, and then I'll eventually just press a little bit deeper with my 3 fingers, and then the 3rd position is even deeper to that.
And you're taking a pulse right now.
So I'm not taking the pulse from the traditional sense of
90 beats a minute, or whatever.
Right, beats per minute, which I'm aware of how fast or slow your pulse is. The pulse diagnosis in Chinese medicine is evaluating what is happening in the body and the organ systems through the different levels that I'm pressing.
So one might be different from another, which tells you something. Because she did that to me, and it was quite amazing. Because you know, she never failed. She'd start like crawling around and tapping on my body, and then all of a sudden, she'd hit a spot, which was the spot, and you'd say to me before I said it to you, you'd say, "Does this hurt you?" And that was pretty amazing to me that you knew that. I mean, I wasn't going or anything like that, like I faked with this, but and so you take the pulses and you tell, and also patient history. And they're a regular physical exam, and then you figure what you got to do, right?
Then we arrive at a Chinese medicine diagnosis.
Okay, and what is it like, or is it in English?
It's using Chinese nomenclature.
Right.
We don't diagnose based on Western terms. It's Chinese medicine terms. So we may say something like, for pain conditions, it's qi and blood stagnation. It's not something we use in the West, but for pain conditions, a lot of times when qi, energy, and blood is not moving and coursing through the body as it should, and it's more congealed and stagnant, it causes pain in the body. So that would be one very common diagnosis for pain.
Yeah, this is amazing. Yeah, since I've been doing this, my wife, who's a hippie and will try anything, including any medicine or drink she can come up with, she says to me, anything that has marijuana in it will heal you now. Now she's on this pot kick that now that's getting legalized, pot can cure everything, you know? All I remember from pot is that it made me forget about everything, and that by itself cured everything. But when you, what is the question I was, I just got completely lost in myself. I can't help it when I talk about my wife and these herbal things. How many visits does it take to do this? I mean, can you cure it in one day? Or does it take time for this to build up?
It's, that's probably the prevalent question that I get from new patients to acupuncture. And my response is the number and frequency of treatments depends largely on the length that they've had their condition and the severity of that condition. So typically something that a chronic condition usually can take a lot longer to treat than an acute condition.
What's a lot longer, hypothetically? You're not talking about 500 visits.
No. In general, most people will see a shift in their condition, meaning an improvement in the right direction, starting from the very first treatment through the 7th or 8th. They'll notice something different within that time frame. And then usually most people, if they have a chronic condition, will have to come in several months, sometimes up to 4 or 5, maybe even 6 months if it's a very severe condition.
But if it's relieving their pain, they'd be more than eager to. I mean, that's what I'm doing. Take it away.
Everyone responds so differently to acupuncture, so it's really hard to put a specific time frame on what it takes for somebody to overcome or heal from a condition.
But they ask that question.
It's a very common question, one that I always like to address honestly, and I wish I had a magic number, but I don't.
Mm-hmm. That's why she's so special. I didn't come here to do a commercial for you, but you really, if you consider this, I'd sure consider her because she's honest. It takes the voodoo out of Chinese medicine, mm-hmm. and if your expectations are realistic, then all you can do is meet them or not meet them. And I have done this now for 4 or 5 visits, and I have definitely seen improvement. It has not gone away, but when it comes, it's less, especially after treatment, that day or those couple of hours afterwards, I feel fine. And I'm really jacked up. I mean, I can't walk. So that's pretty good testimony to you. And I appreciate your honesty, I really do. It's hard, I think this kind of medicine in Western hands can meet a lot of people's needs.
Yeah, my hope is that more people will try acupuncture. There's a lot of people suffering out there and they're not getting the help that they're wanting or needing. And
just another pill.
Right.
Yeah.
So I don't care if it's acupuncture or something else, just try something different that may help make you feel better or minimize the pain that somebody is suffering from. So my hope is just that people become a little bit more broad-minded about there's other treatment approaches. If one form of medicine isn't working for you, try a different form.
Right, and this one's been around for 2,500 years, let's say. Mm-hmm. That's pretty impressive. I mean, 25, and you're located where? You're right by the hospital over there.
We're right across, kitty corner across from Marshall Hospital.
On, was it 1100?
Off of Corker Street.
What's the number?
It's 1108 Corker Street.
Yeah, and it's a nice little office, and she's got this music when you go in there, and it's going, Matter of fact, 2 times while you're treating, because it takes about 20, 25 minutes to go through a treatment, right? That's
25 minutes.
And you always usually do it longer because you're caring. But while she does it, I heard the tape run out, and it was going, and then I heard dead silence, and it seemed like noise after that. The silence felt like noise. And then the tape comes back on, and it just puts you in this zone, and it's very mellow. The last time, I truly went into a place that, I never been besides the 60s. You guys remember what we used to do in the 60s? And now I ride in cop cars. We don't even think about that anymore. But back in the 60s, that's how I felt on your table. It was like I wasn't sleeping and I wasn't awake. I was just in this place, and everything, all the pain, all the doubts, all the worries, all the life, exigencies of life just disappeared. Mm-hmm. And that alone was pretty interesting to me. I mean, to go through this just for that 20 minutes was worth it.
It's a very common side effect of acupuncture is just it balances the body out to where you come to a place of really being settled and in harmony and feeling relaxed and at peace. And most people actually fall asleep during their acupuncture treatment.
Isn't that something?
A lot of men snoring up a storm, and actually I love that sound
Only
because
men?
I know, yes.
No women, guys, women don't snore. They don't have nasal passages.
So far the women have it, but they fall asleep too. But it's just that sound that to me, it's music to my ears, meaning this person is at least comfortable for the 20, 25 minutes that they're on this table. And that's what it's about. And that starts the healing process right there, is allowing your body just to relax enough to where it can start healing itself.
You're a magician. Oh, she's my hero, I tell you that. And if you guys need acupuncture, this is a place to go. 1103, was it?
1108.
1108 Corker Street, right here in Placerville. And she booked up to the neck, huh? She gets lots of people calling. I know my psychologist goes to you. I have 2 friends who go to you. I know a nurse that do you ever get doctors coming to you? They can't let their guard down?
Not yet. Not yet.
But they'll be there.
Hopefully, yes.
Doctors are smart. They'll eventually figure out it's better than a pill. It is better than a pill. Are you going to take these out of my hand? I just want you to see that it really doesn't hurt. So if you're going to, have at it.
Absolutely.
I mean, I don't feel a thing. Now that I look at it, I think it should hurt, but it doesn't. My wife gets nauseous from the needles. Is there something that you can do for that? Is that anxiety?
From the acupuncture needles?
Yeah, when she gets the needles, she gets really anxious.
A lot of times, if people do, it's from the anxiety of getting needled. Sometimes it can be for individuals who maybe are coming in and they're already hungry or they're hypoglycemic.
Oh, really?
They can have that type of adverse reaction. But for the most part, it's people, they're just nervous. So they can get a little upset.
See, and she's just got this peaceful aura about her. The way she talks, the way the whole conditions are, and the music, and the whole place it speaks of healing. And you're a very special person. I'm really glad to be able to introduce you to this community. You've been here how long practicing?
I've been here a little less than 2 years practicing on Corker Street.
That's pretty interesting. She's booked, so call. You need an appointment, call. But I'm not here to do an ad for her. I just wanted to bring to you something that's absolutely changed my life in a lot of ways. I literally now believe in this touchy-feely stuff. I don't know, maybe I'm going to shave my beard and grow long hair and put an earring. I have all of that stuff. So I should have believed in this a long time ago. What's wrong with me? Michelle, thank you so much. I appreciate it.
Thank you for inviting me today. I appreciate it.
All right, and thank you guys for another Hometown Happenings, and call her because it works, and there's no reason you need to be out there and be in pain and drop another Norco or another Percocet, and after a while you're dumb. Okay, you can do this and be sane and sober and still enjoy the quality of life. Thank you for that, for me.
Thank you.
We'll see you next time, folks.